What's up, guys? Welcome back. I'm Dr. Jones, ObGyn, and mom to 4. As you all know, when I start a video out like this, it's gonna be less fun and more learning or frustration or fact-checking. Let's talk about this insanity in Ohio where they've decided to try to pass a bill where they criminalize physicians who do not re-implant an ectopic pregnancy and instead choose to treat it when it happens. I feel like I'm living in some dystopian lie of a universe right now, but let's go. You guys want to talk about this? We're going to talk about it. I wasn't going to address this because I felt like it was just so insanely ridiculous that everybody could recognize that that was the case. But the more I thought about it, the more I started coming up with reasons that we should talk about it, and one of those being the harm that things like this cause. So what we're talking about is a bill that they are trying to pass in Ohio currently. The name of the bill is House Bill 413, and it is not just about this, but it includes in it a section which basically says that physicians can be prosecuted as criminals if a person is pregnant with an ectopic pregnancy and they provide treatment of the ectopic pregnancy, which always ends in loss of the pregnancy. First, let's define what is an ectopic pregnancy. An ectopic pregnancy is a pregnancy which occurs in a place outside of the uterus. 95% of those happen inside the fallopian tube. The fallopian tube does not stretch and grow. So the embryo implants there, builds up a big blood supply, and as the embryo gets bigger, when it exceeds the size of the fallopian tube ruptures. This causes, in some cases, massive bleeding and is life-threatening. Ectopic pregnancy is the primary cause of death in first trimester pregnancies. So out of all the things that people can die from when they're pregnant in the first trimester, ectopic pregnancy is number one. Ectopic pregnancy is not compatible with having a happy ending. You don't have a pregnancy implanted in a fallopian tube and take home a baby in 9 months. That is not what happens. I opened the actual bill and it's very long, so I'm not going to lie. I did not read through all the legal terminology, but it says proposed legislation from page 182 states all possible steps to preserve the life of the unborn child while preserving the life of the woman. Such steps include, if applicable, attempting to reimplant an ectopic pregnancy into the woman's uterus. This isn't possible. This isn't the first time this has come up. It's not the first time it's been included in a bill. My suspicion is that nobody who wrote this bill or signed this bill actually thinks that that is possible. It's used to do exactly what we're doing, which is get people to talk about it and to polarize the bill. So what they're doing is drawing this line in the sand that basically gets people to jump on one side or the other. And having the whole bill be about this helps with their cause, I guess. I don't really know how it all works, but there must be some secondary gain because there is no part of me that thinks everybody who keeps writing this into bills actually thinks it's possible. And if they do, we need to have more medical people consulting on this because it's just absolutely insane. Like, no doctor would say that that makes sense. Even the pro-life ObGyn Society made a statement from like 2010 that said they recognize the loss of life that occurs when a pregnancy is implanted outside the uterus, but that this isn't a situation where anything can be done to fix that. So if you have a group of ObGyns who oppose termination rights in general, saying that ectopic pregnancies should be treated, which like I can't even believe I'm talking about this, then I don't understand why anyone would think it belongs in a bill. And again, my suspicion is that this is a polarizing tactic and it's doing exactly what they want it to, which is drawing attention and splitting people down the middle. You cannot take a growing embryo out of a tube and put it into the uterus. It doesn't work like that. In order to do that, you would disrupt the blood supply. That's just not how it works. Our options basically are we watch to see if it gets better, and some amount will resolve on their own without having surgery or medical treatment. but that can be life-threatening. And then the second option for treatment is a medicine called methotrexate. And the third option is surgical removal of either the pregnancy or the fallopian tube where it's implanted. This is an article which Georgie Borman, I don't know who that is, but this person wrote for the Federalist, which I don't know what that is either, but I'm assuming it's going to be some polarizing news source. Was going to do my hair today and I just decided I didn't care, so this is what you get. So I guess this Georgie person Googled ectopic pregnancy and decided that she knew more about this than a physician who had studied for 12 years to learn about this and how to treat it, and said that knowing that a medical condition carries a very small chance of death is scary, but she asked, is that enough to prompt you to suffer through purposefully destroying your own child? Okay. So first off, I want to say she's apparently redacted this statement. It happened in September, I think, that she wrote this. But second, this is the thinking that is destroying us. This is putting blame on the person in a terrible situation. And if you've never been in that situation, and if it's not your situation to have an opinion on, you should just not have an opinion on it, particularly if that opinion is rooted in complete and utter nonsense. Me sitting around on every patient that I've diagnosed with an ectopic pregnancy and just letting things play out is going to result in someone dying. I'm not okay with that. Georgie Borman, if you're okay with that, you may take your opinion straight to your clinic and practice medicine that way. Given that you are not able to practice medicine, I'm going to assume that you're going to leave those decisions to me because that's what should happen so that I can take care of people safely. And that's the really overarching problem with these bills, is that you can't see the nuance of practicing medicine in a legal bill, and we have to stop polarizing this politically. It's not fair to me and the patients that I am treating for them to have their life taken into someone's hands who doesn't understand what it means. And again, she's retracted her statements in this article, but I'm still going to talk about it because I feel like the damage is already done. And it just really brings to light a very important aspect of internet research, and that's you can't Google something and decide to have a very polarized opinion when you don't really understand what it's about, because you can hurt people. So why does this matter? Who does it hurt? One group of people it hurts is the people who have had an ectopic pregnancy that required treatment and read things like this and think that they were not given all of the options that they should have been given in a desired pregnancy. Of course, we know as doctors that those options aren't real, but when they read these things, it brings them guilt and distrust and just puts a divide between me and my patients who have had these things put in their brain with just really little care about what is actually factual. I don't understand. I just won't ever understand why somebody who has absolutely no training in my field feels like they should be writing full articles on how I should be treating my patients. And then when it gets put into bills like this, again, I think this is a tactic to bring attention and polarization to this bill that they're trying to pass for other reasons, and probably as a distraction technique from other things that are included in the bill. And it's working because here we are talking about it. Another place that this comes into play is that these bills push insurance companies not to cover people's treatment because they lump ectopic pregnancy treatment with elective termination of pregnancy, which is such a totally different discussion. And what you're doing is taking away access and needed care from people who could be in a life-threatening situation. And that does not make sense. So please, we have to stop doing this. So why does this matter? It brings guilt to people who don't need guilt. It spreads lies that are dangerous to people who are in the situation. Because if you're hearing all of these things and you don't know what's true and you have this going on and suddenly meet a new doctor in an emergency situation, how do you know who to trust and who to believe? It should be your doctor. It should be the person taking care of you. And it should not be some uneducated person who Googled something and wrote a viral article about it. And I can tell you, as somebody who has seen someone almost die from ectopic pregnancy on more than one occasion, that the idea that we should just sit around and wait and see what happens is crazy. Because what doesn't happen is that person carries a baby and goes home with a healthy baby. It doesn't happen. Fallopian tube pregnancies do not go on to have babies who are born. I hear you, I see you asking this question, and I know that you're being given all of this information from all of these places. And when you don't know who to trust and you don't know what the answer is, please put your trust in someone who is educated on this subject. If you read an article that doesn't sound quite right, find a trusted, reliable person to get your information from. My goal on this channel is never to tell you, you should just trust me. You should look up whatever you want to look up and find those things and let's talk about them. I have many things that I haven't learned and that I still need to learn. That being said, I also want you to be able to decipher who is a reliable person to get information from. And someone who has no expertise in an area whatsoever should never be your primary source of information. It's okay to hear them out, to talk about it, and to go on and look up other things from a reliable source, but it's not okay to read one article and take that as doctrine. So you shouldn't watch my videos and take what I say as doctrine. If something doesn't sound right, look it up. Send me something that tells me I was wrong. There have been things that I've talked about on this channel, which someone has sent me an article that helped me learn more that I was not 100% correct about. We're always learning. But in this case, ectopic pregnancy cannot be moved from a fallopian tube and into a uterus. If you've had an ectopic pregnancy and that option wasn't given to you, it's because it doesn't exist. We have to stop politicizing healthcare, especially gynecologic and pregnancy healthcare, as a chess piece for people's political narratives. This is dangerous and it will cause someone to either lose their life or to be in a situation that could have been avoided. I'm sorry for being heated. I'm gonna come back down to earth. I don't know if I'll end up posting this because I don't know if it made any sense. This is dangerous. It's not true. Stop politicizing gynecology and pregnancy care before you hurt someone. Let me take care of my people with the training that I have, and you work on lawmaking for things that need laws. Stop trying to politicize my exam room. I don't know how to end this, so I'm just going to revert to my normal, be kind to yourself, to each other, to me. In the comments, be kind. And I will see you next time.